Welcome to HOPE, Polk County's response to the opioid epidemic. HOPE stands for Health and Opioid Prevention Education. As a concerned group of community members, we understand the personal and global impact of this epidemic, and we want to be a catalyst for change. Community members from local businesses, hospitals, churches, schools, government, and public service agencies are working together to bring hope to those who are affected by the epidemic and provide resources to help those who want to break the cycle of abuse it brings. You've probably heard of the word opioid in the media and on commercials, but do you know what they are? Opioids are a class of drugs that include natural and synthetic, legal and illegal drugs, including heroin, codeine, morphine, oxycodone, hydrocodone, fentanyl, and others. Misuse of prescription opioids can lead to addiction. Please pause the screencast and watch the video to learn more. You may be wondering why we need a task force to concentrate on the opioid epidemic. Let's take a look at the numbers. 30% of opioid prescriptions lead to misuse. Of those who misuse, 10% move on to using heroin. 1 out of every 65 deaths in 2017 was due to opioid overdose. As you can imagine from these numbers, we are affected daily, if not directly, indirectly in nearly every area of our lives as a community and individually. But let's bring it a little closer to home. 27% of Polk County youth believe prescription drugs would be easy to get. 13.5% of Polk County youth believe there is slight to no risk when using prescription drugs. 11% of Polk County teens were misusing prescription drugs in 2016. And 115 people die every day in the United States from overdose of opioids. Through the HOPE Project, we believe these numbers will change. Will this affect your coworkers, your families, or you? Yes, it will. Opioid misuse can quickly lead to an addiction, and many times people are addicted without even realizing the problem. Whether you are directly affected by dealing with the addiction personally or with a family member, or indirectly as an employer or teacher, seeing the effects on others, you will deal with the opioid epidemic. So what's our plan? First, we will bring awareness of the epidemic to the community. We want to make the epidemic a part of conversations in the community between coworkers and business owners, clergy and congregation members, school administration and students, law enforcement officers, first responders and public health officials, medical providers, and patients. In order to spread awareness to the community, we will share infographics through social media and print, real-life testimonies through social media. Please pause the screencast now to take a look at this testimony. Social media campaigns targeting different audiences, from those just beginning to abuse to those who have been using for some time, and all ages from preteen to senior citizens. Provide law enforcement and community assistance programs with a list of Polk County resources for distribution, and distribute printed materials at county events and utilize other sources of media such as radio and newspaper. We are working to develop intervention strategies through the implementation of the PDMP, Prescription Drug Monitoring Program, education for healthcare providers and patients concerning alternatives to pain management without prescription pain medicines, education in schools and businesses through DARE and Generation RX or similar programs, and training for law enforcement, first responders, fire protection providers, school administration, and business owners on the use of naloxone. We have created a screencast for teachers to explain what the HOPE project has planned and how they can help to accompany the introduction of the Generation RX curriculum or to introduce teachers to the HOPE task force. The Polk County Health Center will provide naloxone training similar to this example. Our staff has attended the courses necessary to train first responders and public groups who are interested. Law enforcement have a separate training they attend to receive training specific to their duties while working with the public.
Hi, I'm Allison, a pharmacist, and today I'd like to go over how to use your naloxone product. It can be really difficult in an emergency situation to remember everything you knew about naloxone. So, we're going to go back to this video from time to time to review the information here so that you can always be prepared when you have freedom. So, you call 911 and grab your naloxone. Now, this is our case, right? We have the naloxone 2 doses.
The final phase of the campaign culminates with treatment plans. There are options available even now for patients interested in medicated-assisted treatment in Dallas County. As of August 2018, those services are now available in Polk County. There are prerequisites for the program, but a viable option for those who are interested in becoming freed from addiction. This program is offered through our partner, Citizens Memorial Hospital, under the direction of Dr. Kurt Bravada. This video explains how medicated-assisted recovery works to help those who find themselves addicted to opioids. Please pause this screencast to watch the video now. We are also working with the counseling centers in the area to develop a network of counselors to aid in mental health treatment and with local community groups and churches to encourage support of various treatment options. In addition to the medicated-assisted recovery program through CMH, there are plans being made for an inpatient recovery center. This will be several years down the road, but we are looking forward to having this option for Polk County residents. The HOPE project is a community effort. We are all in this together. The opioid crisis doesn't belong to someone else. It affects us all. When we work together, blend resources, and reach out to those in need of help, we can see an effective change in our community and reap the benefits of a safer and healthier county. We would be happy to answer any questions you have for us today. Thank you for allowing us to share with you today. And remember, there is always hope for Polk.